really quite an honor to have you at our press event. You know, last week the governor declared a disaster emergency for the opioid crisis in Pennsylvania. Now, what hadn't been stated is that the General Assembly had actually been working on significant legislation with respect to fighting opioid addiction. The bills on my far left outline legislation that has been introduced by my colleagues, some in the Senate, that has been passed and signed into law. Very effective legislation. 13 meaningful pieces of legislation have begun to address this crisis. It was this good man, Representative Doyle Heffley's resolution, House Resolution 659, which in fact created the Task Force and Advisory Committee on Opioid Prescription Drug Proliferation, which provided many recommendations. They covered prevention, disposal, education, treatment. We created the statewide prescription drug monitoring program, which is being used today. We elevated the crime of drug delivery resulting in death, which is being used by prosecutors against drug dealers and physicians now. We placed limits on the number of opioids that can be prescribed in emergency rooms and to minors. And we established new education standards with regards to saving opioid prescribing in medical schools. There are many more things that have been done and much more to do. Now, here's one of the areas we have not tackled. We have not tackled the problem arising in the workers' compensation system. Many consider that to be one of the areas that pushes people into this opioid abuse. A June 2017 study by the Workers' Compensation Research Institute studied non-surgical claims in 26 states and representing 2/3 of the workers' compensation benefits paid nationwide. Here's the facts. Pennsylvania is the second highest state in the amount of opioids per claim. 87% higher than the median state? Unacceptable. The second highest state in the number of opioid pills per claim at a whopping 258 pills. Unacceptable. And the second highest state in the opioid dosage per pill at 10.2 milligrams. Unacceptable. This good gentleman right here, House Bill 18, enters into the fray. Representative Ryan McKenzie, who has been the champion on this issue, will be speaking next, said there had to be a solution. A Senate bill version followed his version, Senate Bill 936, and it will establish a drug formulary in our worker compensation system. Now, this is a common sense approach, and he's going to explain it. Ryan, is it true it's been adopted in at least 21 other states? And that includes such states as California, New York, and Washington. Not necessarily conservative or pro-business, but states that care about people, like Pennsylvania should. We use them in nearly every other type of health care payment system: Medicare, Medicaid, CHIP, group health insurance. Folks, this is not revolutionary.